that we're not going to get one of our loved ones sick. We all went through this anxiety a year ago. We thought that was the last time. We declared we have to fix it. We have to fix this. And I want to celebrate Thanksgiving safely. I want to know that when we get together, that we're not going to get one of our loved ones sick. We all went through this anxiety a year ago. We thought that was the last time. We declared by this time next year, I'm sure we'll be fine. We'll have that vaccine. And because there are still holdouts, we cannot declare that it's going to be completely safe. So how do you get rid of this pandemic? It is so simple. It is so simple. Get more people vaccinated and get the booster if you haven't had it. Wear a mask indoors, maintain the distance. And I know this is so frustrating because no one wants to hear this again, but we really should be avoiding large gatherings in indoor spaces. So let me talk about boosters because there's been a lot of confusion about this and who's eligible for a booster. If you look at the numbers, we can look at the breakdown. There's room for improvement there. We definitely have the capacity, we have the infrastructure in place, and we have to make sure that more people are getting the boosters. Our seniors are vulnerable because their vaccine that they had, some of them just a little over a year ago, many of them were vaccinated in December and January, starting to wane. The efficiency of this is starting to wane. We saw that, we know that. So the way we can get it, and we know that 47% of people 65 and older had a booster, 47% above 65. That's the population that's going to get sick and end up in the hospital. We have to make sure that they're getting boosters. Let's get those booster numbers up. We're going to continue working with our local healthcare facilities, make boosters available. This is what the state is committing to do. If our counties need help, we're there for them. I've said this all along. I will be there to make sure that you have the resources you need to have boosters available in any place that seniors gather. I want to see them available at senior centers. We're going to be having them even at this facility right here in a couple more days. We're going to have those available for children and for boosters. And if we can protect people with the boosters, we'll be better off. Now, I just talked about people over 65. That's what the rule is, right? Here's the news flash. We live in a high transmission area. This part of the state is a high transmission area. Therefore, there is risk associated with living in a high transmission area. Anyone who lives in these areas and feels risk, that they're at risk of catching this virus, they should go get a booster. I want to be clear about that. You live in a high transmission area, there is risk. If you personally feel that risk, and it'd be hard to imagine anybody who doesn't, because you're among people, you're at work, sometimes in public transportation, you should be getting a booster shot now. I want to be crystal clear on that. Everybody clear on that? You got the message. Get the booster. It has to be a 3-shot if you've had the Pfizer or Moderna. It has to be a 2-shot. You have to get the extra like I did and Reverend Blue did. We got the Johnson & Johnson, then we had the Moderna booster. This is how we get out of this, and thank God we have this available to us. There's plenty of supply. We'll get this out. That's how we're going to get through these holidays safely. And there's no reason not to. No reason not to.